On July 4, 2025, the One Big Beautiful Bill was signed, bringing sweeping changes to American life, especially healthcare. Medicaid, a joint federal-state program for low-income Americans, is at the heart of these reforms. Medicaid covers millions, including children, pregnant women, seniors, and people with disabilities, making it the nation's largest health coverage provider. The new law introduces historic reforms to Medicaid, aiming to control spending and encourage self-sufficiency. Supporters say these changes will make the program sustainable. Critics warn millions could lose coverage and face barriers to care. Whether you're on Medicaid, work in healthcare, or live in a rural community, these changes will have ripple effects. In this video, we'll break down what's changing, who's most affected, and why the debate is so heated. Let's dive into the key parts of the bill and what they mean for American healthcare. The bill slashes federal Medicaid funding, marking one of the most significant overhauls to the program in decades. By over $1 trillion in the next decade, the federal government will dramatically reduce its share of Medicaid spending, shifting more responsibility to the states. States must now either fill the funding gap or cut services and coverage. Many states already facing tight budgets may struggle to maintain current levels of care. A new federal work requirement means most adults must prove 80 hours a month of work, school, or community service to keep coverage. This requirement is aimed at encouraging employment, but critics argue it could leave vulnerable populations without access to care. Exemptions exist for people with disabilities, pregnant women, and caregivers, but paperwork and reporting hurdles have caused many to lose coverage in similar state programs. In Arkansas, for example, thousands lost Medicaid when they failed to meet reporting requirements. States must now check eligibility every 6 months, doubling the paperwork for recipients and increasing the risk of losing coverage due to missed deadlines. This frequent verification process can be especially challenging for people with unstable housing or limited access to technology. For the first time, some Medicaid recipients will pay up to $35 in copays for certain services, creating new costs for low-income families. These out-of-pocket expenses could discourage people from seeking necessary medical care. The law also limits how states can raise their share of Medicaid funds, putting more pressure on state budgets and hospitals. States may be forced to make tough choices, such as reducing provider payments or limiting benefits. These changes could mean fewer people covered, more out-of-pocket costs, and greater strain on health systems. Hospitals, especially those in rural or low-income areas, may see more uncompensated care and financial instability. As states adapt to these sweeping changes, advocacy groups and healthcare providers are raising concerns about the long-term impact on public health and access to care. The future of Medicaid, and the millions who rely on it, remains uncertain. The impact isn't equal. Low-income working families, people with disabilities, rural hospitals, and some immigrants will feel it most. In fact, over 70 million Americans rely on Medicaid, including children, seniors, and people with chronic illnesses. Many working families have unstable hours, making it hard to meet the 80-hour work rule and keep their insurance. Nearly 60% of non-elderly Medicaid adults are already working, but unpredictable schedules can put their coverage at risk. People with chronic health issues may not qualify for exemptions, risking dangerous gaps in care if they lose coverage. For example, 1 in 3 adults on Medicaid has a disability or serious health condition. Rural hospitals, already on thin margins, face funding cuts and more uninsured patients, putting hundreds at risk of closure. Since 2010, over 130 rural hospitals have closed, and more could follow. New restrictions make it harder for some immigrants, including asylum seekers, to access Medicaid when they need it most. Children in immigrant families are twice as likely to be uninsured compared to others. More paperwork and eligibility checks mean more people could lose coverage for procedural reasons, not because they're ineligible. In Arkansas, for example, over 18,000 people lost Medicaid in just a few months due to new work requirements. These barriers could worsen public health and shift costs to emergency rooms, which must treat everyone. Hospitals report higher uncompensated care costs when Medicaid coverage drops. The law's ripple effects will be felt in communities nationwide, from schools to workplaces to local clinics, touching millions of lives in ways both seen and unseen. Supporters argue the bill reins in unsustainable Medicaid spending and curbs waste, fraud, and abuse. Many fiscal conservatives and policy experts believe that unchecked growth in Medicaid threatens the federal budget and could crowd out funding for other priorities. They say stricter rules ensure help goes to those who truly need it, preserving Medicaid for the future. Some experts argue that targeted reforms can make the program more efficient and sustainable, while still protecting the most vulnerable. Work requirements, they claim, promote self-sufficiency and reduce government dependence. Proponents point to studies suggesting that employment can improve health outcomes and financial stability for some recipients. Critics warn the cuts will leave millions uninsured, reversing years of progress in healthcare access. Health policy organizations and advocacy groups argue that the bill disproportionately affects low-income families, children, and people with disabilities. They argue work requirements and paperwork will cause eligible people to lose coverage, especially those with unstable jobs or health issues. Experts warn that administrative hurdles can be a barrier even for those who qualify, leading to unintended coverage losses. Hospitals, especially in rural areas, could face financial crisis as more people lose insurance. Hospital administrators and rural health advocates caution that uncompensated care could force more facilities to close, reducing access for entire communities. The debate is fierce because the stakes are high. Health, finances, and the future of the safety net are all on the line. Experts on both sides agree that the outcome will shape the direction of American healthcare for years to come. The one big beautiful bill is reshaping Medicaid and the lives of millions of Americans. As the nation watches, the conversation continues with new voices and perspectives emerging every day.